Hi, I'm Dr. Sables from ArchMasters Orthotic Shoes and Foot Care in Brentwood, Tennessee. It's marathon season. I'd like to give you just a few tips of what you need to look for during your recovery of one of these marathons. Is it a recovery or is it an injury? Some main problems that I see walking in the door would be a stress fracture, and that would be pain and swelling on the dorsal aspect or top of the foot, usually at the base of the second toe or the second metatarsal. It could be a little bit lateral. But any type of swelling on top of the foot, you want to get that evaluated, especially if it's only on one side. This isn't just a recovery. This is most likely an injury that is a stress fracture. The other thing is if you have a significant swelling, again, basically underneath the base of the second toe, there could be damage to the ligaments or the joint capsule. And the danger of that is that this toe can all of a sudden buckle up and you have a hammer toe, and you wake up in the morning and all of a sudden you have a hammer toe. So this should be addressed because there's significant biomechanical errors there, and that type of an injury should be aggressively treated to prevent future problems. The other thing is blisters. You always hear blisters. Blisters can happen on the arch, the side of the toe, underneath. We have some great products that have wound healing properties in them. You'll be amazed at how much faster they heal than your traditional over-the-counter Neosporin. So come in and get some wound healing gel. The last thing would be pain and swelling, especially if you sort of feel a knot on the back of the Achilles tendon or the side of the arch right in this area. This would be the posterior tibial tendon. This would be the Achilles tendon. Those types of injuries, again, should be treated aggressively because there could be partial tearing. And if you just wait to recover and just kind of take it easy and just wait, that tendon may tear some more, or it could turn into a more chronic condition called tendinosis instead of tendonitis. And then finally, plantar fasciitis. We all have heard of plantar fasciitis. All heel pain is not plantar fasciitis. There's other things that can be ruled out and should be ruled out. But plantar fasciitis, you get a tearing of the plantar fascia, either from the heel bone or actually of the fascia itself. The reason you want to get aggressive with treatments of plantar fasciitis is research will show that after 2 weeks, a plantar fasciitis is actually a plantar fasciosis, itis and osis. The difference is the osis is the fascia starts degenerating, almost like if you took a rope and there was so much tension on it, it starts breaking apart and fraying apart. This is a lot harder to treat than just an itis or inflammation. Again, more assertive treatment would be best in the long run. So those are just a few tips to look for. It's not just recovery if it's on one foot especially, and if you get these swelling or these areas that are causing you some problems, come into ArchMasters for a complimentary consultation. I'll be happy to give you an examination and explain everything from A to Z of what I would recommend. I'm Dr. Sables at ArchMasters Orthotic Shoes and Foot Care in Brentwood, Nashville's only shoe store with a doc, that's me, in every box. Thank you.